Good evening, and thank you for joining us for Hawaii Island Getting Out the Vax. Tonight, we're focusing on how the vaccination efforts are going in Hawaii County, some of the challenges that are unique to this island, and how health officials are helping overcome those issues. Joining us tonight, Lieutenant Governor Josh Green, the state's COVID-19 healthcare liaison, Dr. Christian Kimo Alameda from the Bay Clinic, Representative Kahele, and Jason Dela Cruz from the Hawaii District Health Office. Thank you all for joining us. Now let's start by updating the progress on Hawaii Island with vaccinating residents. Where do we stand today? Mr. Dela Cruz.
Sure, we've seen some great progress on our island. At this point, we're at 44% completed, and 56% of our population has initiated vaccine too. We're operating at about a 93% efficiency, meaning of all of the doses that have arrived to the Big Island, we put about 93% of those vaccine in arms. So we've seen a lot of great progress, but there's still a lot of great work to do in getting the rest of our population vaccinated.
Excellent. Dr. Alameda, what's your perspective from Bay Clinic?
Well, thank you, Gina. I'm so excited to be partnering with the state, and I see Congressman Kahele as well as Department of Health, just to come together to figure out how can we make this happen. And Bay Clinic has been very fortunate. We're a federally qualified health center. I think that's the biggest kept secret in the state, if you will, because we serve everybody and anybody, regardless of their ability to pay. And we target those hard to reach groups, which for this phase of the vaccination effort is critical. So we've been out there in the community, partnering with the state, LG and Congressman Kahele, as well as the Department of Education. Now we've been going into the schools, so it's a very exciting time for us, and we're very happy to be part of the solution.
I think Dr. Green, you have the unique perspective in both in government and as a physician. What do you see there?
I actually worked for Bay Clinic when I first came to Hawaii, so I so appreciate them. They're one of the great organizations. They do reach a lot of people all across that east side of the Big Island. It's a unique situation because on Big Island, we're very spread out. It's harder to get to our rural areas, but they've done an amazing job. And they're pressing hard to get to that 60% threshold where we can kind of ratchet down some of our restrictions. That's very, very important. But it's always hard to get to the younger people. Already there's been success getting to our kupuna, and that's made an incredible difference on mortality. We've decreased the number of people that will pass away from COVID. But our young people sometimes take longer to get to, and we've obviously had fewer months to vaccinate them. So the efforts of the team at Bay Clinic and everyone has to be on deck. I was actually vaccinating some people with Hilo Hospital, and they were talking about how great it was to have the congressman from the 2nd Congressional, dear friend Kai, also kind of leaning into this. So everybody is pushing hard because we have still less access to healthcare overall in the neighbor islands, and that makes it even more important to get all of our people vaccinated.
Well, thank you. And Congressman Kahele is with us. What do you see there for your home island, and what do you want to see?
Well, aloha, Gina, and mahalo for the question. One of the key lessons I think that we learned through this pandemic is that we all have to work together. And we know how to do that on Hawaii Island, is work together. And it has taken a collective effort and the resources of everyone, the public, our private sectors, our NGOs, our all levels of government, both federal, state, and county, to get people vaccinated, to figure out innovative ways to think outside of the box. And I think that's the strength of our communities. And that's the beauty of Hawaii, is when faced with insurmountable odds, we always can overcome them if we work together. It requires leadership at the top, all the way in the governor's office and then lieutenant governor's office, a collective effort across the state to bring people together. And, I think the last year has really taught us what we can do when we're resilient and we come together as a community. And I've been happy to play that role as well. So I think the Big Island has been a shining example of what we can do when we stick together.
Let's drill down a little more on who is getting the vaccine relative to the other islands. Hawaii County's percent vaccinated looks really good, amazing for our kupuna, but not as strong in the percent of population for younger people compared to the other islands' vaccination rates. Why the discrepancy? And we'll start with Mr. Dela Cruz.
Sure, you're absolutely correct. You know, the Big Island has performed exceptionally well for Kupuna. We've got about 98% of that 65 to 74 age group and 97% of that 75 had initiated or completed vaccination. However, for those younger populations in Hawaii County, we're seeing a little bit of slower progress. And this is could be due to several reasons. Primarily, that one reason could be it's just access. I think, as many have already said on this session already, we're a large island, and accessing those health cards, accessing those clinics offering vaccines, always going to have a little bit more challenge in terms of getting actually out there. And so that's that density is going to be a challenge to overcome already for younger populations that may be working or may not have that access directly. Another reason is that our older populations have had priority access to vaccines for the last several months, whereas we've only recently opened up. So these younger folks are now in line, they have access, and it's there's a lot more avenues to getting vaccinated too. So meeting them where they're working, where they're playing, and how we can get vaccines in their arms is really where we want to go to.
Sure, Dr. Alameda, what are some of your ideas about that age gap?
Yeah, true story. It's hard to reach that age gap. Well, first they think they're like, speaking of my own kids, they think they're invincible, right? That's the first thing. Secondly, they bought into some of these myths. I have a son who, oh, Dad, I did the research. Oh, really? So what website? It's that kind of thing. But we are reaching out. Bay Clinic has made a concerted effort to reach out to the schools. We've done St. Joseph. We've done Ke'au, middle and high school. We've done Kamehameha, and this week we're doing the charter schools, Kaumeke. Again, partnering with the state. We cannot expect the state to do it all, and this is where nonprofits such as Bay Clinic, the hospital and such, this is how we do our part. So yeah, but that is that age group is a tough one. We do have some ideas, and I think it's right about the time to start implementing these ideas.
Dr. Green, what can be done to help more young people get this vaccine?
Mostly be time and persistence. I remember when it was the doctor in the southern part of the Big Island, we had a lot of independent thinking young people, very, very strong community, but also strong-willed. And so we had a little bit of vaccine resistance in the Ka'u district where I was for 4 years. So I recall that, but through the Coconut Wireless and through the elders, our kupuna, people did ultimately take good advice. So we'll spread the word. But one of the reasons also, I think that we had extra success with our kupuna and less people so far was already suggested. They stuck closer to the script and the plan on Big Island, which made for a really efficient attack on the highest risk group. And there are only so many vaccines to go around. So it wasn't until early May, we're only a month since that started, that we opened up to the younger people.
Well, let's talk about how the vaccine is being distributed to the community, how it's being done to help make sure it gets to the rural areas especially, and also getting to certain groups like Pacific Islanders who tend to have less access to health care. Dr. Alameda.
Yeah, I think this is one of the bright spots for Bay Clinic and the rest of the rural health clinics, federally qualified health centers. We go to the people. We've had many events in the community. I had Representative Kahele help me out with one in Miloli'i, his hometown. And it's real grassroots. I mean, I think that's the next, this phase has to be kind of that outreach effort, and it has to be culturally appropriate, So for Miloli'i, I mean, you're talking no electricity. So, take down generators, tables, chairs, tents, basically make a clinic, and make it where people will want to come. The vaccine's almost the excuse. You're getting giveaways, you got entertainment, you got free bentos, and good fellowship. And so that's the model we've been using. We've taken that model to Keaukaha, another homestead on the Big Island. We've taken that to Puna, Maku'u Farmers Market, and we've took it to Na'alehu. And so that's the kind of approach I think that we're going to need to implement moving forward.
Well, you're going to have people showing up just for the music and the food who already have their shots. That sounds like fun. Congressman Kahele, what are your ideas for access on such a big island?
What we saw, Gina, during the initial rollout of the vaccine was that in heavily populated areas, there were great opportunities for vaccine distribution. We saw that in Hilo, we saw that in communities across our state. But what we quickly began to realize was that the opportunity to get vaccines out into our most isolated communities, our geographically challenged communities, areas where our kupuna don't have the greatest mobility, their ability to have public transportation, that was going to be our challenge. And so we came together on Hawaii Island, working together with Hui Malama Olana Oiwi, Hawaii Island's arm of Papalokahi, the Native Hawaiian Healthcare Center, working together with Bay Clinic, with Lieutenant Governor Green and other community partners, brought a rural vaccination clinic to isolated communities. And we partnered together to bring it to Miloli'i Fishing Village. And it was very successful. You know, we were able to vaccinate about 125 people in about a 6-hour period, those that would have never gone all the way to Kona to get vaccinated. It was only possible because of the Johnson & Johnson vaccine, which had a lot more, I guess, opportunities for transportation and not the rigid cooling and preparation that the Pfizer and Moderna vaccine required. So that was a great success, where we went, rather than having the kupuna and the community come to Kona, come to Hilo, we went to them. And that was our motto, is we're going to go to them. We're going to do everything we can. We're not going to take no for an answer. And if we even got to bring fishing poles and fishing gear down to Miloli'i, we're going to get that donated and get that as an incentive for people to come out. And it's very successful. And so I'm happy we did that. Even Lieutenant Governor Green, who we invited and couldn't make it, said, you know what, even if I can't make it, I'll do a video to tell people how important it is to come out and get that vaccine that we did back in March. So that was a great example. And I want to go out there and say it was probably the first rural vaccination clinic that happened in the United States, is the one we did in Miloli'i. And it was just a great success story.
What an effort. Well, what are some of the factors playing into that vaccine hesitancy specifically on Hawaii Island? For example, we know a lot of folks might work in isolated jobs or ranching or farming, and maybe they feel they're not at risk. And have you found the legal status of workers to be an issue in hesitancy, perhaps fear surrounding any undocumented immigration, for example? Mr. Dela Cruz.
Sure. You know, vaccine hesitancy is kind of a spectrum. You know, people are going to fall into that spectrum, based on their own life experiences and their beliefs. And, you know, getting people to overcome that hesitancy is really important. It's going to start with an individualized conversation. So I think, a lot of, has been said here, we know we need to get out there. We need to make it easy. We need to make it accessible. We need to kind of push back on those myths. This is a safe vaccine. There is no cost associated with it. You don't need health insurance. And we want to kind of reduce those barriers.
Sure. Dr. Alameda, keep going on that same topic.
For sure. I mean, we are concerned about our immigrant population, and we don't want that immigration status to be a barrier for the vaccination. And so we provide vaccinations to everybody and anybody who's willing to vaccinate, and especially if they meet the criteria and they feel okay with the vaccination. So yeah, I mean, we're even at the point where we're contemplating going door to door. I mean, almost like knocking on the doors and saying, would you like the vaccination? We've tried that at our Keaukaha event because, everybody knows everybody, and it was successful. I mean, so, that might be phase 4.
I like it. Phase 4 is a knock on the door. Dr. Green, you get an earful from everybody around the state, but in terms of hesitancy, what do you hear that is specific and unique to Hawaii Island for hesitancy?
Well, it's unique to populations that are either sometimes first generation or have recently immigrated. There are questions as to trust. Though we have a very trusting community on Big Island, there are some cultural questions. For instance, the act of injecting a vaccination or even a medication into people sometimes challenges some of the cultural norms that have been out there, where people have had other medical disciplines in their societies, among the Marshallese community, for example. Another concern that some people don't talk about is literacy. There are a lot of individuals who are extremely wonderful people, great workers, very productive, but they may not have traditional literacy. And so they think that there may be a sense of shame if they have to fill a lot of paperwork or not know the questions to ask. And you'd be surprised. It's just a lot of people all across America that face that kind of challenge. But when you get to more and more rural communities, it's a little higher rate of people.
Well, it is important to dispel myths and rumors that are related to this. So let's take a moment to do that. Number one, can it affect fertility? Mr. Dela Cruz.
There's currently no evidence that any vaccine, including COVID-19 vaccines, cause fertility problems. Like all vaccines, scientists are still studying, the effects of vaccines for side effects, and those ongoing studies hopefully will provide, some reassurance that it is not causing any fertility problems.
Thank you. Dr. Green, can it affect libido?
So that's an interesting question and point to make. If people get COVID, they actually have a bad case of COVID. We are hearing now in the literature and from some of the best medical institutions in the country that it can cause erectile dysfunction or impotence if you've had COVID. So we want to, caution, especially our men, to get vaccinated to avoid that. But the vaccine itself has not decreased libido at all. So I don't think people have to worry about that. But these are great questions because those are the kind of questions that really resonate in people's minds.
Do you need to get the vaccine if you've already had COVID? Mr. Dela Cruz.
Yes, we don't know how long that immunity lasts from prior infection. So vaccination is still your best strategy to protect yourself from future infection, your family, and of course, your community.
Dr. Green, how can we trust this vaccine when the development was, in some people's minds, rushed?
We can trust it because we've now seen it, first of all, used on hundreds of millions of people without negative effect. But also people should realize that we were already working on the technology and these vaccinations for coronaviruses in general long before COVID-19 came out. So there was already just mountains and mountains of research and millions of research hours put into this discipline. So we can trust it.
Mr. Dela Cruz, people often want to know, can I get COVID from the vaccine?
No, none of the vaccines authorized for use in the United States at this point contain live COVID virus. And so your chance of getting COVID-19 from a vaccine is virtually zero, absolutely zero.
Dr. Green, does it change anyone's DNA?
No, that's a myth from Planet of the Apes and that storyline, but it's not for us here. Really, it does not change your DNA. What happens is the vaccination teaches your body to make proteins against the virus, but it does not mess with your DNA.
Thank you. Well, on that note, let's take a short break. We'll be back with more questions in less than a minute.
Aloha, everybody. My name is Kimo, Alameda, CEO of the Bay Clinic Health Center here on the Big Island, and I wanted to give a shout out to all of the healthcare professionals statewide for your commitment and dedication. And hey, everybody, hang in there. The vaccines are here, but it'll take some time to distribute. So please be patient and continue to wear your mask, social distance, sanitize, and when you get the chance, please take the vaccine. It's the best chance we got to get back to life the way we remember it. In the meantime, be safe, be mindful, and always the double shaka.
Well, let's talk a little bit more about how the vaccine is being distributed. With so many tourists returning to the islands, how are hospitality workers being vaccinated and encouraged to get vaccinated to prevent the spread of COVID? Mr. Dela Cruz.
Sure, hospitality workers were eligible for priority access in earlier tiers, and so we did get, a fair amount of folks offered vaccines at that time. However, some of those workers, some of the larger properties were, furloughed at that time or may have been hesitant. And so there's still ongoing continued work to do there. Again, we're offering clinics to them. And then we're also, we're in discussions with many of the properties to provide clinics on site as well, to make it just easier for them to access vaccines as well. So just a lot of more continued work with individual properties at this time.
All right. Well, many people have been vaccinated, but will encounter those who are hesitant. What can the vaccinated people themselves do or say to help encourage other folks to get the vaccine? Dr. Alameda.
Oh, yeah, absolutely. They can spread the word. In my own family, we've become advocates for the vaccine. And so, amazing what influential kupuna uncles, aunties can do for the younger population, since that's the age group that I think we need to focus on next. But yeah, spread the good news. Congressman Kahele said it the best. We need to role model it, and then we need to dispense some of the fears, particularly coming from those myths that you just alluded to earlier.
Sure. Congressman Kahele, what do you think people themselves should be saying to each other to encourage their friends and neighbors to get vaccinated?
Same thing, encouraging people, sharing your story. I'm young, I'm healthy, but that doesn't guarantee immunity from COVID-19. And many people, including my friends, have had long-term side effects from COVID-19. The first person comes to my mind is State Senator Kalani English, who had COVID-19, and he had long-term issues with that he had to address and take care of his health. So at the end of the day, you got to do this for your community, for your family, for your community members, especially our elderly who are immunocompromised. We know that we're all safer when everyone's been vaccinated. I think if you have concerns, you should talk to your doctor, reach out to your healthcare provider, understand the science, and make that decision for yourself. And in my case, it was the best decision that I made for me and my family. I also trust our leadership. I trust the advice and the recommendations of people like the Lieutenant Governor, who is a medical doctor himself. And so that was something for me and my family that was important, is doing your own homework and ultimately making the best decision and the smartest decision for you and your family.
Well, let's talk a little bit more about the federal government's role in all of this. How have the feds been helping with both vaccine supplies and the financial help for community health centers? Congressman Kahele.
Well, the best and biggest thing that the federal government has done was pass the American Rescue Plan that had billions of dollars for COVID-19 vaccination procurement and distributions, and money that will flow to community healthcare centers. One of the most important things of the American Rescue Plan was to put shots in arms. And the President of the United States made a bold statement that he wanted to have half the country vaccinated by the summer, and we've already achieved that. And so I think what you have seen is leadership in the Congress and in the administration that has put getting rid of COVID-19 as quick as possible is his number one priority. And we've done that by putting billions of dollars into vaccination clinics like the Bay Clinic and vaccine procurement across the country. And that's been really, really important. And we'll continue to do that. And we're seeing results where, like Dr. Green said, the majority of the country is already been vaccinated. Hundreds of millions of people have been vaccinated.
Dr. Alameda, you certainly see that from the community health center side. What would you like to add to that topic?
No, absolutely. I mean, the concerted effort on the Big Island is phenomenal. And you look at everybody on this panel; they're all Big Island connected. And it does take that kind of togetherness. And I think if we continue moving forward, together, we will accomplish great things. There'll be a population, a percentage that just won't take it, and that's their right. And so we also want to honor that as well. But for the most part, I think if we can reach that herd immunity, that would be great for everybody. So we're getting there.
Well, even after watching all of this, if someone is still on the fence about vaccination, what's your final message to them? And also, what's your message to those who have taken the step to get vaccinated? Dr. Green.
Well, first, mahalo to everyone who's been vaccinated. I would say this, you're not just helping yourself by protecting yourself from this virus, you're helping those around you. You're helping your parents, you're helping your coworkers to also not catch it. And more than anything, you're helping all of society. When we reach 60% of our state being fully vaccinated, we'll be able to really ratchet down most of the restrictions. And when we reach 70%, I imagine we will not have any of the safe travels considerations or any concerns whatsoever going forward in this pandemic. So we really are all in this together. And I think that that's probably the most important message to take away.
Thank you. Mr. Dela Cruz.
Vaccines are pure prevention. They prevent illness, and that's their sole goal. From the DOH perspective, I think what we'd like to stress as well is that for every case there are contacts that are kind of ensnared into that quarantine or isolation. As Dr. Green had pointed out, you can bypass that quarantine with presentation of vaccine status 2 weeks out of completing that series. This means you can get back to work. You don't have to quarantine. And for some folks, that may be that big push to do it to get out of that quarantine stage.
Congressman Kahele.
I just want to mahalo the people of Hawaii. This has been a tough year, and we all want to go back to what life was like before COVID. This is one of the most challenging times in Hawaii's history, and we're going to get through this. We're going to get through it together. We're already seeing, I really believe, light at the end of the tunnel. But the most important thing that the people of Hawaii can do to help, Governor Ige, Lieutenant Governor Green, make those critical decisions to reopen our state is to get vaccinated. The widespread vaccination is a critical tool to helping stop the pandemics, and vaccinations can help people from spreading COVID-19 to others. Just remember that over 1/3 of our country is already fully vaccinated. 270 million vaccinations are now in Americans' arms. And so I would just say that it is safe. Please get your vaccination. And the sooner we do that, the quicker we can get back to what life was like in Hawaii and in our country before COVID-19. Mahalo.
Mahalo. And Dr. Alameda.
Absolutely. I think about our healthcare workers. They would like a break as well. And this COVID pandemic has cost them time away from their families, some their lives. And so this is a very serious pandemic. And vaccinations, that's the solution for those who can take it. So we want to continue to encourage everybody to do your homework. Look to the advice of the folks that you love who've already taken it, and do your due diligence. We have a lot more ahead of us, but on Big Island, Big Island Nokaoi, I really believe that we've been through a lot here. The eruption, Hurricane Lane, Hurricane Azelle, these are this pandemic is not new for us in terms of finding solutions to treatments or strategies that work. So we're all in it together, and I'd just like to mahalo everybody, especially KHON. Gina, thank you for hosting this talk story. Thank you very much.
Thank you. And that's all the time we have for tonight. Thank you so much to our panelists for participating and addressing these important issues for our community. And we thank you all at home so much for watching. Mahalo, good night, get your vaccine, and stay safe.